And thank you there, Patrick, for that update on News Radio, KWN 101.3 FM, 1420 AM, KWN TV. Right now, 43 degrees, but kind of chilly rain falling around the tri-state area. 9:39 is our time as we're back to the KWN Today program. Time now for the Newsmaker segment that we follow pretty much every day. With a look at some of the things in depth that are happening around the area. On Thursday, of course, we welcome a member of the Dade County government. We got Dade County Executive Ted Rumley in the studio. Good morning, sir. How are you?
Good morning. Doing good, Evan. Doing good.
Well, appreciate you coming back. This week number 2 after COVID. You seem to be feeling a lot better today.
Well, it's been a pretty good week. I've had just slow. It's takes a lot out of you, and I feel better today. Seems like every day, in the last 3 days anyway, I get mainly is my breathing, but it's back almost to normal. So everything's good.
Well, good deal. Several things going on. Of course, quick update for County Road 6. That's a big traveled, even though it's a small road, it's a very well traveled thoroughfare.
Oh, you talking County Road 6?
Yes.
Oh yeah. That's a big thing right now. They made a big pour up there again yesterday, and it's coming right along. Of course, days like this really kills us, but fortunately, we've not had a lot of them, and we're on schedule. We're still working every day that they possibly can, and so things are looking good. Knock on wood, everything so far is going pretty smooth. So we're still looking at possibly middle of February right now, of opening it back up, hopefully.
A couple of things that are still going on. You got Memorial Ambulance Service is going to be taken over, and I talked earlier in this program. And I guess it's just one of those things that, you and I probably wouldn't think about, but I brought up the fact that, yes, that Memorial, we'll start seeing them answering calls from 911, so if you call, you'll get a Memorial ambulance. But they will take you to any hospital.
Oh, that's true.
You're not going to be, no. It's Memorial, I have to go there. No, you do not. You can go to whatever hospital. I told them there would be times, depending on, especially if it's trauma related, they may recommend you to go to a certain hospital based on your condition of care that you need. But
that's all it will be, a recommendation.
Right.
If you insist, they'll take you to wherever you want to go. As far as that goes. But normally, as a rule, of course, it's changing, I guess, these days. But used to, if you was stroke related, Erlanger's seem to be more, up on that. And then
Erlanger's a level 1 trauma center, so especially if you got something.
And then heart, like Chattanooga Heart Institute, that's big, there. So, of course, now I think they're kind of both are pretty well, are getting close to equal, as far as that goes. But we're fortunate to be that close to our trauma centers. This, just minutes away, you might say.
Yeah, there's places in Georgia that a trauma center is well over an hour.
At least an hour, yeah. And so it's good to be located right here, where we're at as far as medical facilities.
I really don't think the general public is that they really want, other than the different truck that pulls up with Memorial's logo on the side of it. That's about the only thing that the general public's even going to notice the swap over, because a lot of the same people are going to be
a lot of the same
home.
people. Yeah, it's they're going to keep all the people that they possibly can, and
right.
And so that's most people won't even notice it.
Right.
I mean, really.
Exactly. And that will be January 31st at midnight. The first any 911 calls that come in after that will be handled by Memorial. So.
And of course, 911 will still be 911. You have to go right into our dispatchers won't change or anything. Their protocol pretty much the same. So, like I said, right. It's not anything to get all worried about, because things we feel are everything looks good. We'll like you said, be changing at midnight that night, and it should be smooth. I don't foresee anything right now.
The vaccine rolling out in Dade County and North Georgia. I know several seniors, 65 and plus, have already got their first shot. Some are coming up to get their second shot before too much longer.
That's true.
The getting an appointment seems to be the biggest issue of how to now. It started out called the health department, and then the North Georgia Health Department put out, hey, we've started a website. Go to the website and schedule an appointment. There was so many people tried to do that, it crashed, and then they went back to call the health department. I had a gentleman yesterday come in and, asking us, are you going to put out the next time they'll answer their phones and get us an appointment? And I said, well, you need to call them. And they said, well, we tried. If you called the local State of Georgia Health Department here in Dade County in the bottom of your administrative building there, according to the gentleman from Rising Fawn, he said he would call it. They said, if you want to schedule an appointment, push this number. He pushed that number. It went to recording and said, we're not accepting phone calls right now. And he was, well, rightfully so, kind of frustrated that he couldn't talk to somebody.
That's right. We've had a lot of calls like that, and today I'm working on that. I worked on it a little bit yesterday, but I'm actually going to meet with the Catoosa County Commissioner and in probably a couple of hours. I think he's going to call me back. They're having some problems over there. And plus, meeting with him on the vaccine itself, actually getting more vaccine for our county, Catoosa and Walker, and we're jointly going after that. But that problem as far as the answering the phone and all, I'm going to find out what's going on with that. I have called Rome. They have not called me back. In fact, I called yesterday. I'm going to find out what's going on there with that. If I have to, I'll talk to Dr. Toomey if I have to do that, whatever. But we've got to, if they don't have enough help, we need to get them the help to answer the phone at least and tell the people, what's going on, because it's making there's a tremendous amount of people out there that's really upset about it in our county, and so maybe by this evening or tomorrow I'm getting an answer. But I think hopefully you'll see a change next week in this. We've got people, all they want is to actually find out what's going on. If they can make an appointment, if they can't, tell them, but they need to have people answering that phone and talking to these people.
Well, I think that was the biggest concern of this gentleman that came in and actually asked me about it yesterday from Rising Fawn. He said, I just can't even, wasn't even able to talk to somebody.
Yeah.
And of course, what I told him, I said, you might as well just go back and instead of, calling and going to that, if they say push 5 if you want to schedule an appointment, just push 0 and talk to an operator, because they should be doing other things at the health department as they go along. So somebody should be answering the phone anyway, and tell them what your concern is. But I'm glad that you're going to. Now, a lot of folks don't know. It's called the Dade County Health Department, but it's actually a state-run division of the Georgia Health Department.
That's right.
Health Department of the state of Georgia. And even though that it's got the name of Dade, Walker, Catoosa, or whatever, they're actually state health departments, state employees, and they're run.
We do contribute. We contribute a supplement every year, to them. But they are state health. They are state employees, and but still that doesn't matter. They're public servants. That's what you got to remember. Just like I am, and we've got to work this out. I mean, like I said, if they're short-handed, they're short-handed. But we've got to do something. We've got volunteers right now. Go there and answer the phone right now for them.
Well, I know
that's been offered, and they said it's not needed. But yeah, we got issues.
We've got in the last couple of weeks, Governor Kemp issued a. I don't know if it's an executive order or what he did, but maybe an executive order where he expanded the people that could administer this vaccine.
Yeah.
Where it was down to EMTs and paramedics and I forget exactly. We've got the story up at the Mountain Valley Independent where folks wanted to volunteer to be able to help to do some of this stuff. They would be able to do that, and so he issued that, give that extra authority, if you will. I think I read, and this may be wrong, but I think even dentists can administer it. I think he opened it up for a lot of health professionals to be able to help with the distribution. And Commissioner, one of the things I can remember us talking 5 or 6 months ago when the vaccine was not even available yet, having a frank discussion. Will people go out and get it? Yeah. Well, I think we've realized the fact that yes, they will.
They are. Yeah,
we were worried. Will enough people step up and take the vaccine? Mm-hmm. And we've got a lot of people that are waiting to take the vaccine. So that's the good side. That's the good side. We're
letting right now. This morning we're letting primary, use the parking lot down at the Four Fields. They got their patients. Their lot was too small for their patients. The doses they got for people that are, I reckon, primary patients. And they're set up down there. They're only because of the room. And so hopefully the state, when they turn this lesson, that's going to be what we're going to be talking about today with Steve, or the chairman over the Catoosa County, with the governor and with the state, about bringing this in, not just bringing the vaccine in, but opening it up to people like primary and even CVS. I mean, even anywhere.
I do know that is down the pike, but
well, Publix is already, from what I understand, Publix has stepped up the plate in the Metro Atlanta area. I've never even been in Publix, but it's that they have a grocery store. I mean, a pharmacy and all that. And so that's what needs to happen. One of the things, anyway, to get this stuff out here is to make it not only the vaccine, have plenty of that, but have the facilities to give it to the people here and make it easy for them, not to go through the worry of all this, this calling and not answering the phone, or not, but because there's a lot of people out there, especially our elderly people, they're scared. I mean, they really are. They know there's help out there, but they can't get it. So
I went back while you were talking there. The Georgia Department of Public Health is receiving offers from medical professionals and other individuals looking at ways to help. Now, this came from the governor's office. The effective response from volunteers who are pre-credentialed and organized. The Georgia Responder responds, and it says licensed medical volunteers, including doctors, nurses, paramedics, advanced EMT personnel, EMT intermediates and above, may be used to administer the vaccine. Non-medical volunteers may be used in administrative roles, such as registering individuals for vaccine, data input. Now, this is a story that came out from the health department through the governor's office. Mm-hmm. So this was, this is back on January the 15th. Who may volunteer, because the Georgia Department of Health was already getting volunteers. And there is to volunteer, you can even go to a website and register to volunteer. So they have already got a avenue for non-medical personnel to register individuals for vaccine, data input, language interpretation, and other administrative areas as needed, providing guidance and assistance with the vaccination at the administrative site. So
I think they did that last Friday.
Yeah. It's the 15th, which would be about 6 days ago.
Yeah.
That's when we posted the story at discoverdade.com. So that avenue of help for volunteers is already in place and made available through the Georgia Department of Health. So that may help you in trying to
it's there. I mean,
work through some of this
process.
It
already went through that process. So, but we got to do something. We got a lot of people here, not just in Dade County, but they just need answers. They just, if they can't give the vaccine to them, if it's going to be a month or a week or a next day, they just need to talk to these people. At least call them back and let them know what's going on.
Absolutely, I agree with you there. And if it's a situation, which probably it is, that they just do not have the manpower, I know that there's enough folks around here that I can think that
step up
to the plate, help volunteer through this emergency, and take some quick training and being able to at least be able to talk to people. Because I think that's the biggest thing when you call somebody, is just to have somebody on the other end that understands that you're trying to get this and kind of explain the process and be helpful. For sure. So I'm glad that y'all are working on that, and please keep us up to date on what you're doing when you meet with the other executives in Dade Walker.
And we'll post it on our website. What's going on.
You get the 3 o'clock update this afternoon.
That's true.
Here?
That's true.
So maybe you'll have some information on that we can that we can pick up. Any other thing? I know that we've got new electronic electric vehicle pumps.
Yeah, they're up and operating. In fact, there's been several more people than you think that's plugged into them. My office is right there above or down there, and there's been more than people using them than I thought they would anyway. And we got that, and of course I know y'all probably been announcing this, but the fingerprinting the sheriff's lobby Monday, Wednesday, and Saturday. If that's needed, they're taking that. Tire Amnesty Day, which is it was a big deal, last year and all. And I know Kerry's got that on our website, but it's been said it's the last Saturday in February. That'd be on the 27th, and then if it were to snow or rain or be inclement, the makeup day is going to be the following Saturday, which is March the 6th. So that's big right there.
Tire Amnesty, and I understand that you're working several complaints right now with
EPD,
with EPD, not only with tires but also some garbage in the
garbage. Garbage. We got it's getting really bad, especially up on the bordering ends of the county where state lines are at, and they are actually going to be back in the county this next week. But it's the solid waste is really. I don't know why it seems like it's really kind of blew up here, since back in November when we really started having it. Tires are another thing. That's kind of slacked down a little bit because they really come down on some people on these tires coming in out of Alabama and also Tennessee. So, but I'll keep you up on that. But we just got some issues over in the Murphy Hall area in the creek over there. We've got an area there that some fresh. Well, I say fresh. The last week or so old, we've got a lot of mattresses and just household garbage that's been put in that creek. That's being handled today. They called me about that out of Rome actually, and I'm sorry, Cartersville, and so we just I don't know. I don't understand people. I don't understand. We've got
I don't really
people,
understand.
and this is our
those type of folks don't have really regards for other people.
Yeah, and we've got like going up, even up Sand Mountain or up Hell's Gap. Seems the weather gets fitting. The sheriff's department will be working on this, but just look at the garbage that's up through there. It's awful. Just thrown out. I mean, this is just thrown out of the cars. All the way up through there, and we've got down Back Valley Road. That's another one. It's just, and we're going to do a pickup here before too long and get that picked up. But I don't know. People just don't care. I think they don't care. They just
it's really sad. I mean, even you say, well, it was on the side of the road, and that's a county road, and the county can get it. Well, guess what? It costs money, so it takes money out of your and I and whoever is a taxpayer's pocket. That could be used on fixing that road instead of cleaning it up. Yeah. So we have to pay for it. Yeah. And for those that may dump, they may think, well, it doesn't cost me anything.
And plus, it's against the law.
It is against the law.
It's hard to catch them, but when you do catch them, they are
right. I think it's a $500 fine, or maybe $1,000.
I think it's $1,000 now. I believe it's went up.
Yeah.
Years ago when we were growing up, it was like $25. Used to, that's big money back then. But anyway,
I saw something the other day back in the early '70s, or maybe it was the '60s. It said gas was like 34 cents a gallon. I think it was in the '60s. Yeah. Those were the days. Hey, Commissioner, we've got to kind of wrap things up here. Is there anything else that you want to talk about?
No, that's pretty much everything. We've got like I said before, the last few weeks we're ready for any winter weather we might have between now and spring. We're ready to go on that, and just if anyone needs me, my number is 667-8999. It's area code 423, and the office number is 706-657-4625. And you can call me anytime and see what we can do to help you. All commissioners, we are public servants. Their phone numbers are really easy to find. Just go on our website, and they've got their cell phones listed also. And if you need any of us, for anything, we'll try to be there and help you in any way. But we just appreciate everyone working with us, and hope everyone has a safe weekend.
All right, and the update for Facebook on the Dade County government side is going to be at 3 o'clock today, correct?
That's right.
And hopefully you may have some updates on the health department.
Maybe, hopefully.
By this afternoon, since you're meeting with the other county executives. Talk with, I guess we've got about 45 seconds here, but I talked with State Senator Mullis yesterday on the radio. They're in budget talks this week, and he said one of the surprising things, and he thinks it's got to do with the COVID influx of money, that the state budget is they've actually, it's up this year a little bit. I forget his exact words, but it's not as tight as once they thought it would be, and that may be some good news locally, because a lot of our funding comes from
true.
from the state, so that is good. And he said one of the main things that we're going to be doing, and we got about 20 seconds, is of course updating and putting some teeth, if you will, behind some of the Georgia election laws. So he said that was going to be a hot topic.
That is a hot topic,
This,
from what I understand down there. Yeah.
Well, thank you a lot, Commissioner.
Thank
Appreciate you coming in.
Yeah. Okay, we'll be back on. Actually, our update will be 3 o'clock today, so tune in there. Maybe we can give you a little update on this, on the actual what's going on as far as calling in the health department.
Thank you very much, sir.
All right.
Appreciate it.
All right.
Dade County Executive Tim Rumley.